Good evening, everyone. My name is Sarah White. I am a DMP student from Maryville University. As you can see the sign, the topic for discussion is Diabetes Quality Improvement Program for African American men aged 40 to 65. As you may know, over the course of this program, we have been discussing the topic about how prevalent diabetes is among African Americans. We are at higher risk, most especially the men aged 40 to 65, according to research studies. The African American men with this age range are prone to having diabetes. Not just having diabetes, but also are prone to having the complication of diabetes. So that's the reason for this study. And myself, let me tell you a little story about myself from the beginning of my presentation. That will convince you the reason why I am so passionate about this project and having people to have diabetes awareness. It is very, very important. After the birth of my twins, I became diabetic myself. I was diagnosed with gestational diabetes, but I did not want to be labeled as diabetic. That was my problem. I did not. They gave me pills, they gave me this. I took the pills for a year. I said, there got to be something. If there is something that I can control, that can take care of this issue, I will do. Something under my power that I can control. Being a nurse for 30 years, at the time I wasn't 30. Being a nurse for that length of time, I know that what we teach people with diabetes is dietary intake, exercise, stress management. So I went to work. I came across a book from Amazon that was for 8 weeks blood sugar control. I jumped by that book, I ordered it. When I ordered the book, I sat down and read the whole thing, and I went on that straight for 8 weeks. And after that, I went to my doctor. They did my A1C. From my initial A1C was 11%. You imagine? I was a full-blown diabetic. 11% for me. I couldn't believe it. I went back after 8 weeks. She did my blood sugar, she did my A1C. She could not just believe what was happening. She did a test twice. They drew my blood twice. And my A1C came down to 6.7. From 11 to 6.7. Folks, I want to tell you tonight that self-management, diabetes awareness, it works. It worked for me. So I know for sure that this didn't work. So I went to work. To where I work at a clinic in a low-income community. Everybody that come there, most of the men that come there with this age, they come there with a blood sugar like 500. I mean 4 point this. A lot of times we end up sending them to the emergency room for admission to the hospital. A lot of times. So see, there gotta be something that we can do to help these people. So I came up with a program. I thought about it. I started discussing it with the staff and management. I said, there is something we can do. We cannot continue to treat these people and they come back even worse. That means we are not doing something. We have to change the way we manage the people. We have to do something. So we started discussing, and I had a meeting with management. They agreed. I said we have to do something. And at that time, I have just enrolled in this DMP program. So that's how this topic came about. We have so much high acute emission coming in every time their blood sugar is high as anything. But anyway, going back to our presentation, that's a little tip of the iceberg. It's a little bit that I just wanted to introduce the reason why I am so passionate about this project. But my committee members, my chair is Dr. Snell, and my second reader is my instructor, Dr. Stewart, and my community members are Dr. Simmons, Anastasia, she's an MP too, and Shanae is also an MP. The background, I just gave you a little background of how we came about with this program. We know the research, the aim of this research was to teach people with diabetes, most especially African American male age 40 to 65, to teach them self-management so they can be able to manage their diabetes. The initiative is actually to bring diabetes awareness to African American, to the community, about what to look for if they are diagnosed with diabetes, the signs and symptoms of it. According to statistics, the statistic is very alarming. 21 million people in America have been diagnosed, and another 8 million have never even been diagnosed yet. That is alarming. And the prevalence among African Americans is even more alarming. In the review of literature, we know chronic condition is a significant concern in the US. In fact, type 2 diabetes is global. It's global. But we have to do something. We are a developed country. We have to do something about type 2 diabetes. It is pervasive in some ethnic groups like African American and others. The men, African American men, are more at risk than others for the complication of blindness, end-stage renal disease, and amputations. The framework, self-management, self-efficacy is the framework. Self-care. We know that if people learn how to take care of themselves, they do better. But within the African American community, it has to be culturally sensitive. If it is not, they will not even listen to you. Any program that you bring into our community has to relate to us. We must be able to understand and relate to what you are teaching, or else your teaching, we will listen, but it's not going to do anything. The methods that we use, reliability standards were maintained and assured, data quality and adequacy were all done. All measures were sustained with frequent checks weekly to ensure all information gathering processes was constructed. The design we use qualitative retrospective chart review. That was the design. And the clinic electronic medical records were used to collect the data. And African American males under 40 were excluded. The sample. Descriptive statistics were used to describe the basic feature of the data and to provide simple summaries about sample and the measures. And we also used the t-test to analyze the significant difference between BMI score before and after. That's where the sample size became limited because of the COVID. The outcome of the project is noteworthy due to its relevance to type 2 diabetes patients. The status findings are consistent with the national standard, which claims that type 2 diabetes symptoms can be improved with education, medication, stress management, and eating healthy, and also monitoring blood sugar and physical activity. The sample size reduced because of the COVID. A lot of the people, only 15% made it to the end of the program. 5 people were hospitalized in a hospital. Also, five died because of the COVID, and then another 10 participants also did not come because they didn't want to take the vaccine, the COVID vaccination. So they did not show up. That's what decreased my sample size for the project. Data analysis. We use SPSS and then the t-test, as I mentioned earlier, to analyze the means of the independent variables. We use the t-test for independent samples, and then the research variables were the hemoglobin A1C and the BMI. We also wanted to know the difference between the pre and post intervention of hemoglobin A1C and the BMI. The results of the project of the study shows that the A1C and the BMI significantly changed after the education intervention program. On the 15 participants who completed the program, like I said, only 15 of the participants were able to finish the project because of all the different things that were going on, or because of the COVID actually. And as you can see on the graph, the graph is showing that there was significant reduction in the A1C, in the hemoglobin A1C, and the BMI of the participants. And also the healthy food group, there was significant improvement in making healthy food choices, as you can see on the graph. Limitation. The limitation of the project was the sample size. We already discussed that. The limitation was due to the COVID virus. Many people did not make it. 5 people did not make it. 5 person was admitted to the nursing home after discharge from the hospital with COVID because they needed more treatment and more care, and they could not be discharged home. So they were placed. Had a nursing home placement for them. So that's why I decreased the sample size. Discussion. The results of the study are consistent with other studies regarding guidelines to improve self-management of type 2 diabetes. And the research and the expectation was met. The expectation from the beginning was if giving people with diabetes self-management education were going to reduce the A1C to manage their diabetes. We're going to reduce the BMI A1C because they have enough education. If they will know how to manage their blood sugar and get involved with physical activities and make healthy food choices. So that was met. The evidence in the literature is agreeable that improving self-management capabilities among type 2 diabetes helps to improve outcome. Now you can see the implication. The project helped to identify gaps in patient compliance with self-management practices, such as lack of knowledge on self-management strategies and inadequate resources for implementation. The project also exposes opportunities for improving diabetes care through patient education on self-management by disseminating the project's findings and offering evidence for clinical practice to implement improved diabetes outcome. The conclusion. The study results illustrate that improving patient compliance with self-management helps to reduce hemoglobin A1C and BMI. And also that will lead we were able to find that with educational intervention and knowledge and awareness of diabetes, type 2 diabetes, there were fewer visits to the acute care clinic and decreased admission and readmission of patients to the hospital over diabetes-related complications. The study also supports educational programs that are culturally focused to facilitate compliance with self-management among people with diabetes, people with type 2 diabetes, folks. Like I said from the beginning, self-management works. It worked for me, therefore it can work for anybody who is determined. Determination is the key. And making healthy food choices is the key. You must know how to limit your eating and know what to eat, not just eating. The problem with African American diet is that our diet is high in carbohydrates, French fries, high fats diet. That's why this disease is ravaging our community. We must work very hard to try to reduce this epidemic. I call it an epidemic because you don't know how many people have diabetes. It is just so prevalent among us African American. We must do all we can. We in healthcare, we must do all we can to reduce or to bring awareness to this disease. So, folks, if you have any question, please feel free to contact me. Anything about diabetes, because we can do this. We can help to solve this puzzle. That self-management is the key to managing diabetes condition. Type 2 diabetes can be managed if you are determined to limit what you eat and to be mindful, not just limiting, to be mindful of what you eat. Because we have to take care of yourself. What you put in your mouth, you have control over it. So you don't just put anything in your mouth. If we can control what we put in our mouth, therefore we can control diabetes. We can reduce the prevalence of it, and we can learn how to manage it to prevent all the complications that go along with it. Type 2 diabetes is very devastating in the African American community. So we must work hard. We in healthcare, we must do everything we can to bring awareness to people who do not know how to take care of themselves. Most especially, any program that we have to do, we as we in healthcare must be able to help, most especially advanced practice nurses. This is our time. We must work hard with people who have diabetes and bring awareness to the community so this disease can stop spreading the wildfire in the community. Thank you for listening. That ends my presentation. These are my references, some of my references. Thank you.